Did you know that 1 out of 3 people in the US will develop cancer in their lifetime? Here's the shocking part. Millions of cancer cases could have been caught earlier if people recognized the warning signs. Early detection could be the difference between a 90% survival rate and one that plummets to below 20%. It's time to learn the subtle signs your body might be sending you, signs that could save your life. Cancer doesn't always start with dramatic symptoms. It whispers before it shouts. But most people don't know what to look for, and that's where things go wrong. We often ignore subtle changes in our bodies, thinking they'll pass or don't mean anything serious. But catching these early warning signs can make all the difference. Today I'll share 10 subtle, often overlooked signs your body might use to alert you to something serious. These aren't just random internet claims. They're backed by science and can help you or someone you love catch cancer before it's too late. Early detection can significantly increase the chances of successful treatment. So if this information could save a life, it's worth every second of your attention. Ready to empower yourself with this life-saving knowledge? Let's dive in. Bone pain. Bone pain is often one of the most overlooked early warning signs of bone cancer. Cancer-related bone pain doesn't always feel like a typical injury, and it's much different from the soreness you might experience after a workout. According to research published in the Journal of Bone Oncology, persistent bone pain that intensifies at night and doesn't respond to typical pain. Relievers could be a sign of primary bone cancer or secondary cancer that has spread to the bone from another part of the body. The pain is often described as deep and throbbing, and it may worsen over time, becoming constant and debilitating. In some cases, you may even notice swelling or unexplained fractures. It's important to recognize that bone cancer doesn't only affect the bones in the arms or legs, it can occur in any bone in the body. Early detection through imaging tests can make a huge difference in treatment outcomes. If you notice persistent bone pain, especially if it's coupled with swelling or fractures, it's essential to consult with a healthcare professional promptly. Eye pain. Persistent eye pain that doesn't have an obvious cause can signal ocular melanoma, a rare but aggressive form of eye cancer. Ocular melanoma originates in the pigment-producing cells in the eye and may not be detectable without proper screening. According to studies published in Ophthalmology, the symptoms can start subtly but become more noticeable over time. These include blurred vision that doesn't improve with corrective lenses, flashes of light in the field of vision, or the appearance of a dark spot on the iris that gradually changes in size or color. If left untreated, this cancer can spread to other parts of the body, which is why early detection is crucial. Ocular melanoma is more common in people with light-colored eyes or fair skin, but anyone can develop it. If you experience eye pain, vision changes, or notice dark spots in your vision, make sure to get an eye exam from an ophthalmologist, especially if you have a family history of eye cancer or have been exposed to prolonged sun exposure. Early intervention can help preserve vision and prevent the cancer from spreading. Body rash. An unexplained body rash can sometimes be a symptom of leukemia, a blood cancer that disrupts the production of platelets, which are essential for blood clotting. In cases of leukemia, rashes such as petechiae, tiny round spots that appear on the skin, may develop. These rashes are usually red or purple and do not blanch when pressed. The American Journal of Hematology explains that these rashes are caused by a deficiency in platelets, which allows small blood vessels to leak and form spots on the skin. These spots tend to appear in areas where pressure is applied, such as the ankles or around tight clothing. In addition to rashes, people with leukemia may experience unexplained bruising or bleeding, which are other important signs to look out for. If you notice a persistent rash that doesn't fade, especially if it's accompanied by unexplained bruising or bleeding, it's important to see a healthcare provider immediately. Fingernail marks. If you notice a dark streak under your nail that seems to appear suddenly, it could be a sign of subungual melanoma, a form of skin cancer that occurs under the nails. Unlike typical nail discoloration, melanoma-related streaks tend to be more irregular, dark in color, and may expand over time. A study from dermatologic clinics notes that these streaks may start as a small, unnoticeable line, but grow wider or change color, eventually becoming more noticeable and potentially painful. In particular, the streaks that are wider than 3 millimeters or have irregular borders should be evaluated by a healthcare professional. In addition to the streak, you might notice nail splitting, bleeding, or tenderness around the affected area. Early diagnosis of subungual melanoma is crucial, as the prognosis is significantly better when detected in its early stages. Unexplained night sweats. Night sweats that drench your bedding and clothes without an obvious environmental cause could be a symptom of lymphoma, a type of blood cancer. According to blood reviews, night sweats are often accompanied by other symptoms, such as fever and unexplained weight loss, creating a distinctive set of symptoms that oncologists use to diagnose lymphoma. These sweats are the body's immune response to the cancerous cells within the lymphatic system. If you find yourself waking up drenched in sweat, especially if it's consistent over several weeks, it could indicate a problem with your immune system and warrants medical attention. Often, lymphoma-related night sweats occur alongside other systemic symptoms like fever and weight loss. If you have these symptoms, it's important to consult a doctor. Persistent heartburn. Chronic heartburn that doesn't respond to over-the-counter medications could indicate a serious condition, such as esophageal cancer. The American Journal of Gastroenterology reports that long-term acid reflux, or gastroesophageal reflux disease, GERD, can damage the lining of the esophagus, leading to a condition called Barrett's esophagus. This precancerous condition significantly increases the risk of developing esophageal cancer. If you have heartburn that persists despite lifestyle changes, such as dietary modifications or medication, and it's accompanied by difficulty swallowing, weight loss, or food getting stuck in your throat, you should consult a healthcare provider. Early treatment of esophageal cancer is crucial for improving the chances of successful treatment and survival. Jaundice, characterized by yellowing of the skin and the whites of the eyes, can be caused by various conditions, but sudden onset in adults should raise suspicion for liver or pancreatic cancer. The Hepatology Journal explains that in pancreatic cancer cases, tumors may block the bile duct, leading to a buildup of bilirubin in the blood, which causes the yellowish tint. If you notice jaundice along with abdominal pain, dark urine, or pale stools, it's critical to seek medical attention immediately. Jaundice is often one of the first signs of liver or pancreatic cancer, and early intervention can significantly improve survival rates. Don't ignore these symptoms, as they may point to an underlying condition that requires prompt treatment. Fever. A persistent fever without an obvious cause could be a sign of blood cancers like leukemia or lymphoma. These cancers can cause the body to release chemicals known as cytokines, which trigger fevers. Cancer epidemiology reports that these fevers often come in cycles and may be accompanied by weight loss, night sweats, and fatigue. Unlike typical fevers caused by infections, cancer-related fevers tend to persist and may not resolve with usual fever-reducing medications. If a fever lasts for more than 2 weeks or occurs repeatedly without a clear cause, it should be evaluated by a doctor. Blood cancers can compromise the immune system, making you more vulnerable to infections, and can also cause unexplained fevers on their own. Breast changes. Any change in the size, shape, or feel of your breasts should be taken seriously, especially if it's accompanied by pain, discharge, or a lump. According to the Journal of Clinical Oncology, regular self-exams and mammograms are crucial for early detection of breast cancer. Even minor changes, such as dimpling of the skin or unusual discharge from the nipple, can be warning signs. Breast cancer doesn't always show up as a large lump, and it may not cause any pain initially. If you notice any changes in your breast tissue or experience pain, it's essential to consult a healthcare provider for further examination. Early detection through mammograms and regular screenings can greatly improve survival rates. Swelling. Unexplained swelling, especially in the abdomen, legs, or lymph nodes, can be a sign of cancer. Tumors may obstruct fluid flow or interfere with the lymphatic system, causing localized or generalized swelling. According to research published in Cancer, swelling that persists or is accompanied by other symptoms, such as pain, fever, or weight loss, should be thoroughly investigated. Swelling can occur when cancer affects organs like the liver or lymph nodes, or when it causes fluid buildup. If the swelling doesn't go away or is painful, it's important to seek medical attention. Early diagnosis and treatment of cancer can help prevent complications and improve the prognosis. Recognizing these silent warning signs is crucial for early detection of cancer, which dramatically improves treatment outcomes and survival rates. While these symptoms don't automatically mean you have cancer, they deserve proper medical attention if they arise. Early detection can literally save lives. If you found this video eye-opening, hit that thumbs up and share it with someone you care about. It could save their life. And if you want to keep learning life-saving tips, make sure to subscribe to our channel. We're here to keep you healthy, empowered, and ready for anything life throws your way.